Good evening, everyone. Let me welcome all my viewers once again today on Heart Mitra. It's always a pleasure connecting with all of you live on these programs with our expert speakers. As you are aware, Heart Mitra is created for all of you so that you keep on getting the latest information related to your cardiac health. At the same time, we also invite for you leading cardiologists from across the country who can talk to you directly as a friend. I'm very glad today to welcome Dr. A. Purnanand from the city of Vijayawada. Sir, welcome to the program.
Thank you, Sanjeev.
A lot of our viewers keep on asking and putting chats around hypertension and how do we define really the hypertension, what it can lead to, and what are the ways to easily identify and act timely. So today we will be seeking help from Dr. Purnanand using his expertise to talk on this topic. But before I really start taking your questions, let me formally introduce him. Dr. Purnanand, he is one of the senior most cardiologist in our country. He did his super specialized training in cardiology way back in 1995, and for last 30 years now, almost 3 decades, he is serving his patients who are coming to him with the problems related to the cardiovascular or heart. He has presented many papers in the scientific conferences and many awards to his credit. And currently, he is chief interventional cardiologist at Purna Heart Institute in Vijayawada. So, with this, let me straight away bring you on the stage and for your opening comments on this topic, and then we will take in the questions of the audience.
Sanjeev, this is the hypertension is one of the biggest killer diseases in our country. Actually, it is the simplest disease where it can be detected even at primary health center level and treated with the classes of drugs which are safe and which can be given easily and which is very affordable. But unfortunately, many people have a lag of looking this hypertension as the most casual disease, do not take serious attention towards its diagnosis, treatment, and follow-up. All these three things are important. Diagnosing it correctly and in the earliest as possible. Diagnosing hypertension late is one of the biggest problems leading to complications. So, diagnosing it as early as possible, treating with the most effective drugs, but just not taking a tablet and thinking that my hypertension is under control. But you should be looking at regular intervals, what that your drug is working and your blood pressure is under the target control, under the target level, and always should be checking that what hypertension is causing damage in your most important organs of the body, basically heart, kidney, retina, and brain. So it is not just hypertension diagnosis, taking one tablet and forgetting that you have a problem, but should be diagnosing it correctly, treating it effectively, following it up continuously is the mantra for the management of hypertension.
All right. So, sir, taking a cue from your opening remarks, only where you said that even detection and diagnosis, it's a major issue in our ecosystem. So, how do we, in the current times, because I'm sure that the parameters keep on changing. Currently, how do we define, like, that what blood pressure number is, like you say that, okay, this is now hypertension or high blood pressure, or are there any different stages or different age groups of, this hypertension, which you would like to tell to our viewers?
Basically, we are well aware that the normal pressure should be 120 by 80. So this is one figure which everybody is very much aware of, that the blood pressure should be 120 by 80. And there is a stage between 120 by 80 to 140 by 90. 140 is the systolic pressure. That is when the heart pumps the blood, that is the blood pressure that is recorded externally in the artery. That should be 140. When the heart is relaxing, that is, it is the diastole, so the blood pressure should be 90. So 140 by 90 is the target where we initiate treatment for hypertension. In between 120 by 80 to 140 by 90 is what we call as a pre-hypertension stage, where once detected, this patient should be under regular follow-up at least every 2 weeks to 2 months for to check that the patient's blood pressure has gone more than 140 by 90. So till 140 by 90, there is no need to give medical treatment, but there is a need to adhere to lifestyle measures like cutting down your salt intake to as low as possible, reducing your weight, taking regular exercise, eating more fresh fruits, and cutting down on your non-veg food items, and then seeing that if alcohol is a big problem in your lifestyle, cutting down on the alcohol binges and also reducing the total amount per week are the important things where in the lifestyle management most of the patients between 120 by 80 to 140 by 90, if they can take care of these measures, their blood pressure will be mostly under control. So 120 by 80 to 140 by 90 is what is called pre-hypertension stage. Various societies like Indian Hypertension Society, European Hypertension Society, American ACC or AH have given various parameters to how to classify the blood pressure. But two important things which require attention are your normal blood pressure. If you are a normal, healthy adult, blood pressure should be around 120 by 80. If the blood pressure is more than 140 by 90, your blood pressure, you are a hypertensive patient. If it is just touching 140 by 90, you have to initiate lifestyle measures. More than 140 by 90, you need to be put on some medication along with lifestyle measures. In all patients who have hypertension, lifestyle measures are the first line of defense. Then you have to add treatment. So you cannot do only treatment and forget about the lifestyle measures, which is the usual problem in many of the patients. So adhere to lifestyle measures and add treatment to that. Just giving treatment does not make you healthy. You can only be cured. You can be only controlled hypertension, but you will not become healthy and prevent complications related to hypertension. So you have to reduce alcohol, reduce weight, do regular exercise, cut down on your salt. Such kind of things should be there along with the medication. If it is more than 140 by 90, you need to be put on some medication. If your blood pressure diagnosed at the initial stage, at the first reading only, if your blood pressure is more than 160 by 100, that is a warning sign, and immediately the treatment has to be started. And many other times, it has to be two drugs to see that the blood pressure comes to reasonable control with a very short period of time. Because already the complications may be set in, and sometimes the patient may present you with complications when the blood pressure is very high. So see that the blood pressure does not touch 140 by 90 if you are in 130 by 80 bracket. And if the patient is 140 by 90 bracket, see that it does not shoot up to 160 by 100, which requires immediate attention. So if you remember these three things for a lay public, 120 by 80, normal, 140 by 90, treatment, 160 by 100, emergency. So it should be taken care of immediately. And we have classifications, JNC and all those things, but probably that may not be very much relevant because
Yeah.
hypertension is hypertension. It's 140 by 90 or 160 by 100. 160 by 100 requires immediate attention. 140 by 90 requires management as early as possible.
Sure. No, I think these are some very vital informations for our viewers, and the way you have explained, simplified, I'm sure our people will remember this. So 120 by 80 is normal. If it touches 140 by 90, then you need treatment. Don't ignore it. But if it is even further reaching, going crossing 160, then it's a serious condition, and you must then take proper advice of your doctor and take it further. So we keep on hearing now that this is happening now in earlier age groups as well. A lot of younger people are catching hypertension. So can you help us understand that what are the primary causes of hypertension, and are there any specific group of people who are at higher risk, so that they are cautious and keep on screening themselves?
Basically, there is a totally understanding, there is a lack of understanding regarding hypertension. Hypertension is thought to be a middle aged disease, but it's not. So usually the hypertension starts at the age of 25 to 30. But many of the people who think that they are normal, who does not require any medical attention during that time, usually go neglected. People think that they are hypertensive or they need a blood pressure check when they try to when they lose temper frequently or get headaches or vertigo or such kind of symptoms, which are very late in the stage of hypertension. hypertension is basically a symptomless disease. It is a silent killer. So it has to be sought. It does not inform you when it is coming and when it is getting on to you, because many of the times the patient may be presenting with complications of hypertension than symptoms of hypertension. So the basic idea is the blood pressure process starts at the 25 to 30 year age, and it is evident that it will come to 40 years by the time that many of the patients will become present with complications. In medical school, because we have a chapter or we have a practical demonstration of blood pressure checking, when medical students were checking their blood pressure, one medical student checks the other medical student's blood pressure, or if to go to the hospital just for the sake of checking blood pressure, they used to check the blood pressure. Many of our medical students were found to be hypertensive at the age of 25 to 30. So that is the biggest problem. And so many of the medical students or doctors take blood pressure treatment very early in the medical career or very early in the age. So I have some 10 to 15 medical students who have very high blood pressures who are on treatment since last 10, 15 years, from the second year of their MBBS. So that is that blood pressure starts, the process starts very early in the age. So don't be under the impression that it starts at 40, 45. So a blood pressure recording is the simplest investigation which is found on the earth. There is no need for any injection. There is no need to do anything. Just sit relaxed. The blood pressure, the nurse will try the blood pressure cuff. The doctor recorded the blood pressure. It's a 5 minute job, can be done in any private center or any primary health center and everything. So diagnosing blood pressure is the easiest possible. Only thing, sometimes we have a any some discrepancy, like is there blood pressure or not? Do you initiate treatment or not? So for that, we have now ambulatory blood pressure recording. So a blood pressure monitor, the apparatus will be tied to you. For 24 hours, the blood pressure is recorded, so that we can identify where are the surges of blood pressure, where are the troughs of blood pressure, what is your blood pressure during sleep. So all these things are very important in putting the patient on drugs, sometimes diagnosis, and sometimes assessing which patient has likely to go into severe complications. A patient's blood pressure who does not drop during sleep is a very high risk patient. This patient is likely to suffer lot of complications because of blood pressure. So you have to diagnose the simplest way by recording the blood pressure as early as possible at 25, 30, 35. And now with the lifestyle changes which are occurring in our youth, alcohol has become a norm than a that's the exception. Every, if it is male or female or anyone, alcohol has become a norm. If somebody is not taking alcohol, means he's somewhat different from the crowd than the normal crowd. So with the alcohol is one of the commonest causes of hypertension, and it is reversible. So don't think that the blood pressure you can only affect 40, 50 people. 40. If a person who is consuming alcohol on a regular basis, a young fellow of 25 years is likely to have high blood pressure. And if that fellow stops the the alcohol, then his blood pressure can come to normal. But persistent alcohol consumption make him chronic hypertensive and complications related to hypertension. So no age is barred from hypertension, but the earlier age of hypertension, earlier the age, the chances of what we call as secondary hypertension are high. Now we classify blood pressure into primary hypertension and secondary hypertension. Primary hypertension means there is no cause. It is because of the genetics or because of your lifestyle plus your stress and your work and all those things all combined together, where there is no single reason. It is called primary hypertension. So the next one is called secondary hypertension. Secondary hypertension is related to some cause, like kidney disease will cause hypertension, alcohol will cause hypertension. So there are some hormonal imbalances like pheochromocytoma or such kind of diseases causes hypertension. So secondary hypertension can be cured. Primary hypertension has to be controlled. It cannot be cured unless until the lifestyle measures can cause a 10 millimeter blood pressure drop, not more than that. More than 10 millimeter drop is needed, then you have to add drugs. Secondary hypertension starts very early in your life. So if you identify that, you can try to cure it and sometimes prevent major complications. So every 25-year-old should get a once blood pressure checked. See it is 120 by 80 or 130 by 80.
So I think it's a very clear guidance which has been given by Dr. Purnanand here, that if you have these risk factors which you mentioned, like a family history or like genetic reasons, or there are consumptions of alcohol, smoking, or stress, then don't ignore this situation. It's better that you start screening yourself at an age of 25 onwards. So it doesn't, and also he emphasizes that this is the easiest thing, easiest diagnosis on earth. You go to any, even the primary healthcare center, nursing home, any general practitioner also. So it's very easy to screen, or let's say find out how much is the blood pressure. And if it is more than 120 and 80, as we earlier mentioned, then I think you need attention and medical care on this. So ignorance can be a problem here. So thank you very much for emphasizing this, and making our viewers understand in an easy language. Now I also want to understand, sir. Now many a times we may miss out on these things. So if someone is having an uncontrolled hypertension, then what kind of consequences it may lead to? Are there any other cardiovascular diseases also which it can lead to because of increased blood pressure levels?
So increased blood pressure basically first affects the heart, because once the blood pressure rises, heart has to struggle to pump against the highest pressure. Normally in the aorta, what is the major blood vessel, the blood pressure if it is 120 by 80, heart can function without much stress. If it is 140 by 90, it has to pump against resistance. Once it starts to pump against resistance, the heart muscle becomes thicker. Like what you exercise in gym, if you put up with the skeletal muscles, you will put up muscle volume and muscle size will increase. At the same time, the heart muscle thickness increases when there is high blood pressure. But the problem in heart is the muscle thickness increases, but the blood supply does not increase. So you have a thick muscle with less blood supply pumping against resistance. So this muscle is under a lot of stress. So it gets less blood supply. Progressively, it fails. So in India, the commonest cause of heart failure is blood hypertension. Untreated hypertension is the commonest cause of the congestive cardiac failure, which is a very serious disease. So that is the major problem which occurs in heart, and which is usually neglected and very presented very late. So that is one, heart failure is one important factor which leads to one of the most important complications related to heart in relation to hypertension. Next one is the well-known heart attack, the acute myocardial infarction. Here, the because of the flow dynamics in the blood vessels supplying the heart will change. So there may be disruption of the innerest layer of the blood blood vessels. If the inner layer of the blood vessels is called endothelium. So in endothelium, what does it do is the blood flows inside the blood vessels without getting contact with the blood vessel itself. So there will be two negative charges, one on the endothelium and one on the blood RBC, that is called the red blood cell. So the blood does not touch the blood vessel and there will be a smooth flow. Once the hypertension occurs, the endothelium gets disrupted. So the blood flow does not is not very smooth, and there will be blocks in the blood vessels, ultimately leading to heart attack. It may be acute, that means the high blood pressure suddenly precipitates a heart attack, or a chronic hypertension leading to multiple blocks in the blood vessels, ultimately leading to stent procedures, surgeries, and various kind of medicines. So that is related to heart. Another important organ is kidney. So in kidney also, the most common disorder which is causing chronic kidney disease is hypertension. And this causes severe morbidity and mortality. That means lot of disease, quality of life is disturbed, and death occurs. And then not only the patient, the whole family suffers because of kidney disease. Dialysis and such kind of things are very common. These two things are very much preventable. Chronic kidney failure, chronic heart failure, both can be prevented with a very basic minimum treatment of hypertension. So these two organs are the basic. And the most common complications related to hypertension is stroke, the brain stroke. So if this means that leads to paralysis. So these three things are the major problems in our country: chronic heart failure, chronic kidney failure, and brain stroke. So 90% of the people related to hypertension have one of these problems at some point of the age, and younger people having at a very young age, and this is disrupt the whole family and the whole economy system, and the medical system will be overburdened by this kind of things, which are these diseases, for which we need to take a lot of attention in treating the hypertension.
Okay. So I think here it's a very clear message. If we ignore or if it is left untreated, hypertension, then it can lead to bigger issues related to heart failure, kidney failure, or even brain stroke. So which means that I think Dr. Purnananda's it's a very compelling case that you must identify this early, and then along with your doctor, manage it well as well. Sir, still, just one last question I want to still ask you on how to, really diagnose it timely. Now, this is not a general practice in our society that, at we don't get this managed, like that's a reality until and unless we get admitted to a hospital for something, or we get sick, and then a doctor will do it. But can you help my viewers understand that are there any most common symptoms for hypertension, which people can remember, like if these two three things are happening to me, then probably it is a high blood pressure and I immediately must go and get it checked.
So that is the biggest problem with the hypertension is usually in the early stages you do not have any symptoms. So, but there are symptoms which may which should alert a younger person or a 35-year-old to seek the doctor's advice is recurrent headaches which requiring analgesics to be taken. That is one thing which you should not neglect. And sudden fits of anger. So what happens is you only know that I should not have been I should not have been angry so much for this small thing. But at that moment, if your blood pressure shoots up, you trip and you may scold somebody beyond a point, or you lose temper and you may spoil a relation, or you do such kind of things, or pick up a fight with somebody. So sudden loss of your temperament disproportionate to the event, it should make you to check the blood pressure once again. Vertigo is one symptom which is commonly seen, or whichever commonly observed. So many of the times patients have vertigo, that is lightheadedness or giddiness, which makes the patient to see if the blood pressure is right. But one important thing is symptoms should not guide you to seek medical items. You should get one blood pressure check every year starting from 25 years. That's the only way you can go for blood pressure. So there are other features which are described in textbook, like if you have to get up for urination 2 to 3 times in the night, even if you are not a diabetic. So such kind of things also may suggest to you that you may have blood pressure. But ultimately, you should not be relying on that. That is edema of feet. That is, you have water in your feet or such kind of things. So these are all features which are related to complications related to hypertension. They are not per se related to blood pressure, high blood pressure itself. So checking the blood pressure, even if you are asymptomatic, every year after 25, somewhere or other, just put a hand across when you are taking your father to the hospital in free time. You get bored. Everybody feels that we are wasting time bringing the father and waiting for the doctor for long hours. Just go there, ask the nurse, talk to her politely, and put a hand across. Please check my blood pressure once. That makes things many a times easier for you, and you can note the blood pressure. And 1 year again after you take your father to hospital, then also you can go and check. So that's the way you should be looking at. Or any medical camp is going on, or anywhere, just check your blood pressure free of cost. At least don't go to the doctor consulting. Get a blood pressure free of cost. Or if you have a blood pressure machine in your home, for your father, your grandfather, or anybody, just try to just check your blood pressure. Sometimes they may give erratic readings. You may be getting, you have to get cross checked. But ultimately, if you are getting a signal that your blood pressure is higher than normal, then probably then you are on the right path to look for a doctor and identify it properly and treat it effectively.
Okay. So I think this is so very clear. He has told us that these are the symptoms. Look out for these three, four things. Just in case you forget this, don't worry. This program is going to stay here. Just go rewind this back, listen to him again. But then he makes a very strong point that don't wait for the symptoms. The symptoms may not show up. So at the age of 25 onwards, get yourself checked. Just do at least once a year your blood pressure check and measure it. So now, once a patient is, let's say, or once an individual is diagnosed as having hypertension, then what do you do as a doctor? Are there like too many medicines, which a patient has to take to control it, or other than medicine, do you also recommend lifestyle measures, and what are they? Would you like to guide our viewers on this?
So once you diagnose to have blood pressure, we need to confirm it. It's sometimes when the mere coming to hospital raises blood pressure, and mere blood pressure checking also raises blood pressure. So the anxiety of blood pressure and the doctor seeing the doctor, seeing the hospital premises itself is a big trigger for making people becoming hypertensive. So this is called what we call as white coat hypertension. The fear of doctors, the fear of hospitals, and now the hospital bills and the procedures which are the procedures which are being undertaken by the doctors running into lakhs. So if the thought of going to hospital itself may raise your blood pressure. So and being sick is one of the things which we want to avoid by all costs. Though we don't do anything which is which will keep us healthy, but we don't want to get sick for whatever reason it is. So the idea of getting a blood pressure check itself may raise the blood pressure. So you have to be guarded against what is called as white coat hypertension. So just one reading of 140 by 90 does not make you hypertensive. So again, you have to check in a different kind of setting, and sometimes at home also, because a blood pressure raise may be there in hospital, but at home it may be normal. This is called white coat hypertension. So we have to identify properly, diagnose properly, initiate lifestyle measures day one: salt cutting, regular exercise, weight reduction, eating out should be as minimum as possible, and try to cut down on your alcohol and spicy foods and such kind of things. Go for a healthy way of living, which is very much obvious these days. There are so many WhatsApp messages, so many so on social media, so many people preaching so many things. Don't eat this, don't eat that, don't eat. So you take up which is ever is practical to you and try to follow the healthiest lifestyle that will reduce 50% of your blood pressure. That means 10 millimeter of blood pressure can come with lifestyle measures. Then medication. Medications are very simple. We have only 4 or 5 medications. Most of them can be taken once in 24 hours. So the compliance with hypertension medication is very simple, and the side effects are very least with the number of drugs which are coming up. Single tablet will make your blood pressure normal. So go to the right doctor, take the right medication. Many of the things will be sorted out. Keep going to the doctor for monitoring. Check for the target organ damage. That is very important. The whole exercise of treating hypertension is basically to prevent target organ damage. What are the targets? One is retina, two is brain, three is heart, four is kidney. So these are the target organs. Retina means in the eye. If the retinal bleed occurs, you may become blind. Brain, if you have a stroke, you may be lying down in the bed for the next part of your life. Heart attack, you may lose life, or congestive heart failure, you may be patient for lifelong. Chronic kidney disease, the most miserable of all the things. So target organs have to be monitored. So in the basically, when the hypertension is diagnosed, we run a very basic test to see how the target organs are there. ECG, probably echo or some blood test to see that how kidneys are functioning, and then start on the medication which suits the patients. So younger patient may require a different drug. Older patient may require a different drug. For now, it's not that all patients should get one drug only. Depending upon the patient's lifestyle, patient's age, and patient's side effect profile, and the target organ damage, we need to give a drug which can be usually taken once in 24 hours. Some very rare 160 by 100, then you have to take two drugs. If they have two drugs also, you have some combination which can be taken in a single pill. So and then regularly monitored, first in 15 days or once in 15 days, then probably 3 months. Then after, if the patient is very stable, after 4 months or 6 months, and once in a year, just check for the target damage. It is very simple, very economical, very affordable, and very, very, very effective. So you have to remember that it's not just very important that it's a very costly treatment or some unaffordable. You can go to the basic doctor, believe in him, get the right kind of treatment, follow it effectively. Unless until your blood pressure is not getting under control with one or two drugs, then probably you seek this help of a specialist, a hypertension specialist, or a cardiologist, or a physician, or something. So treatment is simple. So just don't neglect it. That's it.
Yeah, so I think it's a very clear message. It's a treatment is easily available. It's simple. It's very affordable. So you don't need to worry too much around this that it or get into an anxiety. Uh, I think all you need is to identify it timely with the help of your doctor or symptoms and take proper medical care. That's it. That's what is a summary message. And visiting a doctor or hospital as well, can increase your blood pressure. So so allow your doctor to sort of diagnose you properly as well, unless you have a doctor as smiling as Dr. Purnanand. So maybe after seeing him as well, your blood pressure may go up, but in his case I think it can potentially come down as well, just seeing that. But sir, other than medicines, what are the lifestyle measures you recommend to your patient, and which of the lifestyle measures, let's say exercise or meditation or food modification, what brings
So
best result to a patient?
best results for in our Indian context is to cutting down on salt intake. So normal salt requirement for us is 3 grams per day. So usually WHO recommends less than 5 grams per day. But most of in South India, especially in these parts of the South India, the average consumption may be anywhere between 10 to 15 grams, and sometimes it may touch 20 grams per day. So this is the major cause for blood pressure in many of the South Indian, many parts of South India. In North India, it is less. It may be around 10 grams per day. So for everything from papad to this one, everywhere we use salt, 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 salt. Table salt has become the worst enemy for hypertension. So salt is the biggest problem for hypertension. So if you cut down on salt intake, your blood pressure will drop by 5 millimeters. So if you bring the salt intake to 5 grams, which is very, very unpalatable, you cannot put the food in your mouth if, with a 5 gram per day salt schedule. But you should be making it a habit, and the mother should make it a habit for the children to consume less and less salt. All this stored food, packed food, all contains heavy salt. So don't eat the Lays and such kind of things, chips which are stored, which contains huge salt, which unknowingly you eat so much salt in a day. Pickles are the biggest source for your salt because to preserve, many of them were salted, and that was in yesteryears. That was where in the historic Stone Age, that because the food was not available regularly, so they used to store it because with the salt because to make it preserve for a longer time. Now we have come to computer age, and where still we are very much fond of pickles and salted food, preserved foods, and such kind of things, which contains huge amount of salt. So cut down on your salt basically by all means. Look at what is the salt content in every food. Reject whatever is heavily salted. That is the biggest way to prevent hypertension. That is number one. Number two is weight. Keep your body weight in the ideal range. So overweight people are more likely to become hypertensive. That does not mean that thin people do not have hypertension. But overweight, obesity is one important cause for hypertension. The more obese you are, the more likely you will have diabetes and hypertension. So weight reduction is important. Sedentary lifestyle is another important thing which will make you hypertensive. So keep walking. Don't take Johnny Walker, but keep walking. So you try to make that your exercise should be adequate to your life, to your age, and your activity. So 5 to 10,000 steps. If you are more than 60, 5,000 steps. If you are less than 60, 10,000 steps per day is the norm. So if you are not able to do 10,000, at least 2,000 steps per day is very, very minimum for every age, and based upon your physical flexibility and also your time and all those things. So you can make it 5,000, 4,000. So We not being sedentary is another important factor in preventing blood pressure. What you eat. So many of the people do not take. There are some children who do not take fruits or vegetables or anything. They only want non-vegetarian chicken or something else. So vegetables are the most important part of your food chain. So you should be eating adequate vegetables. Cut down on your non-vegetarian diet, especially children. Even children are becoming hypertensive because of the faulty food habits. So see that vegetables are the very part of it, and fruit should be 25% of your diet if it is possible. Especially as you are more than 40, make fruits as 25% of your diet. Breakfast, you take fruits, or dinner, you take avoid other things, you take fruits. So fruits, fresh fruits, seasonal fruits are an important way because they have a lot of potassium. They'll see that the blood pressure drops less, and you have a very comfortable stomach. You don't eat more mangoes or such kind of acidic fruits. But if you eat fruits, they see that your balance, mental balance, physical balance, acidic balance keeps in a very positive way and make your blood pressure to drop down because they contain a lot of potassium. So vegetables, fruits, and the weight and oils. So the lesser the oil, the more palatable the food is, the less complications related to heart are there. So make it less oil, less salt, and more fresh fruits, vegetables, especially green leaf vegetables and such kind of things will make your lifestyle better and also your blood pressure into a normal or near normal category.
Hmm. I think this is such a fascinating discussion, and we are learning so much today from Dr. Purnanand. Unfortunately, we are running out of time, and I have to be cognizant of that. I'll take one last question, sir, from you. It is also said that along with the things which you mentioned, stress is also anxiety is also a big contributor to hypertension. And in current world, there is so much stress around. In the younger population, there are work related stress, there are family related stress. How do you advise your patients to, or people who visit you, to manage this situation as well?
So after the advent of software boom in India, probably our real estate has grown up and probably our lifestyle has switched up to a probably we are probably staying in fourth floor apartment now has gone to 24th floor apartment. But the what it has changed is the total health profile of our total system from the younger age to the older age. So that made us to eat outside, and the advent of Swiggy and such kind of delivery systems make ordering easy. And eating biryani has become the order of the day. Previously, biryani was cooked during festival days. Now it is the order of the day that every day some people are eating biryani. And the software boom has changed the health profile of many of the people. And because of the payment is high, the chances of patient we are trying to people 500 crore rupees of uh, molecules or drugs or some other things are very difficult for
Yeah.
the employees and making a lot of stress in the that kind of segment. So software employee starts to become hypertensive at the age of 25. He joins job at 21 and his blood pressure is almost more than 140 by 90 by 25. And another people is marketing. People who are on marketing job or sales job, their blood pressure, they start the job at 25, by 30 they have blood pressure of more than 140 by 90. And even the education system and various the way the political system and all those things around make us stress as the most important aspect of our life. Even if your life is comfortable, people around you make your life uncomfortable for various reasons. Family makes you uncomfortable. Politicians make your life comfortable. Your boss will make your life uncomfortable. Or there are so many other people who can make your life uncomfortable and make you under stress. So stress is the most important factor which is available free of cost to everybody. So anybody can how much of stress he want, he can take it. It is available free like air. Stress is also very much available these days. And that is the most important contributor of not only making hypertensive, but also when this fellow is likely to have a heart attack or a stroke or anything. Patient who is hypertensive, not taking treatment and under stress is likely to suffer problems very early in life, making it more stressful for him and for his family.
Hmm. So I think take care of these things as Dr. Purnandan suggested us. This is like, uh, if you control these things, take care of these things, you can very well manage your blood pressures, hypertension. And if we are able to diagnose and act timely and control hypertension, it will save you from a lot of other problems which may happen because of hypertension over a long period of time. So I think that's the message today. If you have anyone in your friends or family circle who are having these kind of risk factors which he mentioned or lifestyles, then you can simply share the link of this program with them, and this conversation and advice given by Dr. Purnanand can be very very useful for those individuals. But before, sir, I conclude this program, I hand it over back to you. If you still want to summarize it or emphasize anything important which we have missed, you can give the closing remarks.
Yeah, hypertension is the most common disorder which can occur from the age of 25 to 75. Don't think that you will not become hypertensive. So you can become hypertensive without you knowing it. So it does not have any symptoms. Keep checking blood pressure as frequently as possible, at least once in a year after the age of 25. Treatment is very simple. Once the diagnosis is made, treatment is very simple and very effective. Complications of hypertension are very dangerous, and it can spoil your whole family, and not only you, and it can damage your family and family life also. So lifestyle measures for everybody is very important, including children in these days. So then you have to see that the lifestyle, a healthy lifestyle is followed, and it is adopted in every home. It does not only to patients, so it should be adopted in every home. Make your job and earning proportionate to your talent. Don't make an earning which is disproportionate to your talent and your qualification. That will make you more stressful. You may earn more money, but you may die early without enjoying the money which you have earned. So try to make a balance and be spiritual. It does not mean you should not take alcohol. Be spiritual and try to make some time for yourself. That is me time. That is time for yourself, for reading books or meditation or yoga or such kind of things where you are with your own self. So 24 hours you should not be with somebody where it makes life more stressful. So keep 1 hour for yourself in every part of the day so that you can relax and think, rethink what are your strategies and try to make your life more comfortable for yourself and for your family. So remember these mantras and try to make your life comfortable. And if you are hypertensive, then you can always consult doctor and take a appropriate treatment. Thank you very much for
Oh,
a patient.
thank you. Thank you, Dr. Punanand, for this. I think this has been really very useful for all our viewers. I'm sure that the advices which you have given would be heard, understood, and followed by our viewers who see you today. And to all our viewers who joined us live, we thank you. And all those who would be watching this program later on as well, we thank you as well. If you need more information on this or advice, and if you live somewhere in Andhra Pradesh and Telangana, you can always visit Dr. Poonanan at Vijayawada. However, if you are listening this program somewhere in other city and you get symptoms which he mentioned, or you have your blood pressure levels more than 120, meet your doctor immediately and take proper medical care. So with this, we thank everyone. Thank you, Dr. Poonanan, for joining us today
Thank you,
and for
Sanjeev.
this lovely messages. Good night, everyone,
Good night.
and